diets and doing it via dried commercial food is, yes, it may lower some of the protein, and animals, they actually start to leach more potassium, and then that's why animals get one. Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona, co-founder of Kygenesis and of the Kidney Disease Solution. And today I wanted to do a video about treating kidney disease in our family, furry friends, and our pets, in cats and dogs. Let's start by having a look at kidney disease in our animals. So kidney disease affects about 1 to 3% of all cats and about 0.5 to 1.5% of all dogs. And it's actually one of the leading causes of death in cats as they age. So it is actually something that's really great to know about, things that you can do to treat, and actually things that you can do to prevent declining kidneys as our pets get older. In dogs, it's going to be the Samoyed, the German Shepherd, the English Cocker Spaniel, and the Bull Terriers are actually more prone to kidney disease. And in cats, it's generally the Persian type breeds. But in reality, if the conditions are right, any of our pets can go on to end up with diminished kidney function if we're not careful or if we're not doing the right things for our pets. So what is different in our animals is that we obviously can't do, or we don't tend to do, kidney transplants and dialysis for our pets. So when we're looking at how to treat kidney disease, it's very different for pets versus our human friends. And also that I think preventing kidney disease in our pets is something that we should really, as pet owners, be really thinking about, because it's harder for our pets to tell us when there's something wrong. You know, animals are very stoic by nature. They don't tend to tell us when things are going on. And ironically, most dogs and cats in kidney failure produce actually huge quantities of urine. It's not that their urine flow diminishes, which is something that people would often look for. And unless you're having annual routine blood tests, diminished kidney function can often go completely unnoticed by pet parents unless you absolutely know what you're looking for, or unless it gets caught up, it gets tested and caught just as a offside when you're having other bloods done. So early detection and renal protective treatments are designed to slow the progression and the loss of damage to neurons. So treatment of kidney disease will very much depend on the cause and the severity of the disease. Because your vets aren't going to be doing things like dialysis and kidney transplant, they're then generally using medications. And so that'll be things to lower blood pressure if it's high, monitoring and treating things like diabetes. They can use fluid therapy, so they'll often run an IV through the pet to really help hydrate the pet. They'll use things like ACE inhibitors, and then probably the major thing is they'll use renal diets, but they are dried commercial foods. And so my problem with renal diets and doing it via dried commercial food is, yes, it may lower some of the protein and it will lower some of the phosphorus, which is a big issue in pets with kidney disease, but it's still dried kibble. So I think you're actually better off working with someone who's knows how to build raw diets for kidneys, because that way then you're going to get moisture in there. And we also know that feeding raw diets to dogs is genetically and cats, genetically what they're designed to eat. So therefore you're helping other things like reducing inflammation and things like that if you do that. Other ways that they'll treat it are using alkalizing dietary alkalizers that they add to food, fluid therapy, which I recommended, and potassium supplementation, which is really interesting because in humans, your nephrologist is most likely to tell you to take potassium out. It's the opposite in pets, which is one of the reasons that, if you've seen Emily and I do a video about potassium, and actually taking potassium out, unless it's warranted via a blood test, will make kidney disease worse. And that's exactly what we see in animals. They actually start to leach more potassium, and then that's why animals get, one of the reasons they get muscle loss and they become weak is because they're clearing too much potassium. So then they'll add potassium in there. If your pet's anemic, then they'll, boost that up. They may use something called recombinant erythropoietin. And then if it's in late stages and your animal's not eating, they'll use appetite stimulants. And then in some rare cases, they can do enteric dialysis. But it's very uncommon that you'll find a vet doing dialysis on a pet. Generally, they'll be recommending euthanasia. So the standard of care for veterinary medicine often neglects to take into account simple lifestyle and dietary and nutritional things that we can do that are often just as effective, in fact, sometimes a little bit more, and have far fewer side effects. The other great thing about looking at preventative care and potentially treating your pet naturally is that you not only take care of the kidneys. If your pet's kidney disease is caused by chronic inflammation and you switch them to a raw diet and add things in like fish oil, which has been shown to be very, very good for both cats and dogs with chronic kidney disease, that will actually help reduce the inflammation. So then you start to treat things like diabetes and arthritis and all of those sort of things. So we're looking, the way that we as naturopaths look is we're looking for a more holistic, encompassing approach to work with our animals and with humans, rather than a one pill that has side effects and then you have to take another pill to manage those side effects kind of model. I hope that you found it useful. If you did, give us a like. Remember to hit subscribe so you'll get notified anytime we put out new content. And if you have a comment or need some specific help, chuck it in the comment section below. I'm always looking at the comments and I will promise to get back to you. Have a beautiful day. Thanks again for being part of our kidney community. And until next time, I'll see you then. Bye.